Time for another Skewer and Cure.
Here you go.
Thanks. Many techniques have been proposed for phacoemulsification of the human lens. As these techniques have progressed from sculpting to divide and conquer to cracking techniques, they become more and more efficient and better able to handle harder, thicker nucleuses. One of the problems that we have in the United States is that not all nucleuses are extremely hard, and very often softer nucleuses don't do well with these techniques because it's difficult to crack a nucleus which does not have the sufficient density. In this video we see a demonstration of the Skewer and Cure technique. In this technique, a capsulorhexis is performed, which is keyhole shaped, with a slight extension in the area of the incision. This small extension allows easier cortical cleanup at the end of the case. It also allows us to mobilize the lens. Vigorous hydrodissection is done with a sweeping circumferential motion, and the nucleus is simultaneously mobilized with the hydrodissection cannula. The lens is tilted so that the anterior portion of the lens comes into the iris plane and into the anterior chamber. When this lens position is achieved, the phacoemulsification handpiece is inserted underneath the lens, and a second instrument, in this case a Beckert nucleus rotator, is inserted through the paracentesis. Both instruments penetrate the lens, and a cracking motion is often able to divide the lens into two segments. The remaining portion of the lens can be grasped by turning the phaco probe bevel down and applying suction. With this technique, all of the phacoemulsification takes place in the iris plane or a little bit anterior. This eliminates the problem of sculpting out parts of the lens and then trying to gently grasp the perimeter of the remaining nucleus without penetrating the posterior capsule. Phacoemulsification done in this manner, because the lens can be aggressively manipulated with both instruments, tends to minimize any phaco energy and maximize the ability to physically disrupt the nuclear fragments. Phacoemulsification performed in this manner tends to be very rapid. One disadvantage of this technique is that the phacoemulsification takes place closer to the cornea. However, clinically, any significant increase in corneal edema postoperatively does not appear to occur, possibly due to the high efficiency of the nuclear breakup and the minimalization of phaco energy that's utilized. Here we see another example of the Skewer and Cure technique. Not every nucleus is divisible into two fragments upon the initial maneuver. In those cases, typically quadrants or smaller pieces can be chipped off with the two instruments. However, even very dense nucleuses can be handled with this technique. And soft lenses are very rapidly removed with extremely minimal chances of involving the posterior capsule. In summary then, the Skewer and Cure technique is a technique of phacoemulsification which is very efficient, ideally suited for soft lenses, but works on harder lenses as well, is a very rapid technique that minimizes phaco energy and has a very low probability of involving any posterior capsular rupture. It's a technique that has some unique benefits for surgeons developing their skills. in terms of safety and has some strong advantages for softer lenses. However, can be used on all cataracts and has some efficiencies that give it a particular advantage in any situation. So now we can all go out and skewer and cure.